We're about to go live. There we go. All right, good morning. Welcome to the Senate Budget and Taxation Committee's Subcommittee on Health and Human Services. We will have 4 budgets that we will hear analysis of today. We will start with the Maryland Commission on Civil Rights, followed by State Archives. Then we'll have the Maryland Department of Health, Office of Healthcare Quality, and we'll close with the Secretary of State budget. So we have, starting out, we'll have our first presentation by Analyst Samuel Quist. Good morning, sir.
Good morning, thank you. Yes, I will be presenting the Maryland Commission on Civil Rights. I will share the presentation on my screen here so you all can see it. All right, so you should be seeing the presentation now. The fiscal 23 allowance for the Maryland Commission on Civil Rights totals approximately $3.9 million. This is a slight increase, about 0.5% over the fiscal 22 working appropriation. And as you can see in Exhibit 1 on the next page, the majority of the budget for the agency supports personnel expenses, about 89% or $3.4 million out of the $3.9 total allowance. Moving to Exhibit 2 on the next page, this shows the major changes in the budget. Again, the most largest area here is related to personnel expenses. There's about $168,000 increase in this area. The largest category within personnel expenses is the health insurance cost category. There's also a couple of one-time decreases due to one-time expenditures in fiscal 22. There's about a $95,000 special fund decrease due to the civil rights event and other outreach activities, as well as a $70,000 decrease due to replacement equipment purchases for information technology. This $70,000 decrease, this corresponds to a proposed fiscal 22 deficiency appropriation that's part of the budget plan. This deficiency appropriation totals about $99,000 in spending in FY22 for a similar purpose, information technology, equipment purchases, and other operating expenses. On the personnel data page, the budget includes funding for 33 regular positions and 1 contractual position, which is the same as the previous year. And moving to the key observations section, as part of its annual Managing for Results submission, the Commission reports on a couple of performance measures related to case processing and cases received. Exhibit number 3 shows the number of inquiries and complaints received per year. In fiscal 21, these are declining in part due to impacts of the COVID-19 pandemic. The Commission notes that the area of employment cases are the largest typical area that it receives each year, and there's been some impact in this area related to the increased use of teleworking and working from home, which has led to less incidents occurring in workplaces and less complaints in that area. Exhibit number 4 shows a similar trend. This is showing the number of cases closed by case type per year. In this chart, the blue portion of the bar is for employment, the red corresponds to housing, and the green corresponds to public accommodations. And again, you can see the housing, the housing has a slight increase. The employment is decreasing, and the public accommodations is also decreasing due to impacts of the pandemic. The next chart, exhibit number 5, is on the average case processing times. This is again broken down by each of the 3 main case types. And you can see that the case processing times are continuing to increase during fiscal 21 at a slightly larger rate than in previous fiscal years. And the 2021 Joint Chairman's Report included committee narrative that was requested last year during the legislative session last year, requesting some additional data from the commission on their factors impacting case processing times, including the number of pending open cases, as well as some other information on investigator staff load, investigator workload and staffing. The report submitted by the commission earlier this fall indicated that the increase in case times can be attributed to staffing constraints as well as a backlog of pending cases in an effort to manage the average investigator workload to a manageable threshold. The report indicated that there were about 896 pending cases at the end of the fiscal year, and it also provided the average workload per investigator, which kind of, it depends on the unit that they're involved in and a few other factors, including the experience and the complexities involved. The report, it was also asked that the commission reach out to some other jurisdictions and other states that had similar size caseloads. And as a result of this outreach by the commission, they found that other jurisdictions and other states are seeing similar case processing time increases and similar issues related to staffing constraints. And these other organizations averaged about between anywhere from 270 to 365 days on average for all case types, which is fairly consistent to the times exhibited in the chart on the page. Lastly, in the analysis, the Department of Legislative Services is again recommending that the subcommittee request similar committee narrative in the Joint Chairman's Report this year, providing similar data as of the end of fiscal 22. This would include an update on pending and open cases, as well as some additional information on the current investigator workload. And then we're also asking if the commission has any other factors or any other items impacting staffing or case processing times to include in the report. But I believe that concludes the DLS presentation, and I can take any questions at this time.
Thank you. Are there any questions from the subcommittee for the analyst? Senator Eckert.
Thank you very much. Do we have, over the past, let's say 5 years, documentation on the length of the case processing? I mean, I was just curious whether it's taking longer now than it has in the past. You know, that factors in the whole discussion that I think the analyst presented. Do we have that, Samuel?
The data that's included in the managing for results data, yes, that was the data in the line chart exhibit 5. That was the average number of days to process a case broken down by caseload type. And that data should be available for the past 5 years.
I was just thinking it might be curious to see what the number of staff were and what the processing time was as we look at it on an annual basis to see if there have been any trends. And then on top of that, there may be, some cases are probably clean or easy to review and make a disposition, but others may be more complicated. So there may be some other factors in that. I was just curious, that it does seem like a long time, but then we don't know how many cases there are per person and what goes into that. Thank you.
Thank you, Senator. Other questions from subcommittee? Okay, I just have one, and thank you, Mr. Quist, for your analysis, and this is informative. It's been a while since I looked at the JCR report, and I'm not sure if we asked this question last session. I wonder if we asked, and this may be something that we posed to the executive director, who we're going to hear from in just a minute, but did we ask them for suggestions on how to mitigate this backlog? And how to address, because when I looked at the staffing personnel data on page 4 of your analysis, it looks like it's been virtually unchanged for the past couple of years. So it sounds like we have an issue that could be addressed with more manpower. Did we ask them that?
No, that was not necessarily that wasn't a question that was included in the request last year. Mainly the request last year asked for identifying the staffing, but it didn't really go into any proposals to address that.
Okay, well, please make note, Mr. Quist, I'll be coming back to you with maybe something later, depending on what we'll hear from Mr. Gillard. And maybe we'll add that to what the DLS recommendation.
Yes, sure. We could work on adding that to the recommendation.
Yeah, I want to be helpful. This is an important issue. Thank you so much. I don't see any other questions for the analyst, Mr. Quist. So we'll turn to Mr. Alvin. Is it Gillard?
Yes, ma'am.
Okay, good morning. He is the Executive Director of the Maryland Commission on Civil Rights. Good morning, sir.
Good morning, Senator, and good morning to members of the Senate Health and Human Services Committee. We certainly appreciate this opportunity to respond to the Department of Legislative Services fiscal year 2023 budget analysis. We'd also like to thank our analyst, Sam Quist, for his thorough analysis. As has been the case in recent years, this spending plan presents challenges for the Maryland Commission on Civil Rights. We have worked creatively and consistently to respond to our greatest challenges, and we believe our greatest challenge is accepting complaints of alleged unlawful discrimination and investigating them in a timely, fair, and professional manner. We have reduced cases that were in unassigned status as of September 1st, 2021, from 567 cases down to 287 cases. And while this represents great progress, it does impact the individual caseload of each investigator, which increases the likelihood of cases not being immediately put into assigned status. Now, I would like to point out that both the comments of Senator Eckert and you, Madam Chairperson, reflect the challenge that we face. Our Deputy Director, Cleveland Horton, who has responsibility over case processing, can certainly share a little more detailed information as to time and process and how the number of staff people impact our ability to investigate cases in a timely manner, if you'd like him to do so.
Sure, I think that's appropriate in response to Senator Eckert's question. Sure, Mr. Horton, good morning.
Good morning, Chair Griffith and members of the subcommittee. Thanks for allowing me the time to give you some more insight into the wonderful work that we do at the Maryland Commission on Civil Rights. So when we think about from an historical perspective, back in fiscal year 15 and 16, the Maryland Commission on Civil Rights saw a drastic change in the number of complaints that our agency had. We went from approximately in fiscal year 2015, 518 intakes to 996 in fiscal year 2016. One of the things that you pointed out, Chairman Griffith, is that our staffing has stayed the same. So when your complaints double, and your staffing changes and your staffing stays the same, it creates somewhat of a frenzy around how do we continue to make sure that we're addressing complaints as quickly and as efficiently as possible. Typically with our complaints, it's not an immediate result, right? So when we get a double of complaints, it's not something that you see on Monday, right? It's something that they age over time. So what we're seeing now is the effects of what happened back in fiscal year 16 with the doubling of the work, and our staffing levels haven't changed to meet that. What we've always done as an agency is try to meet the challenge, figure out how we get the work done. Our staff at the Maryland Commission on Civil Rights honestly has been burning the candle at both ends, which has caused us to also have a high turnover rate. We've had the ability to attract great talent, but our problem has always been keeping that talent. Individuals come into our agency and they were facing at the time caseloads of over 100 cases, which was just unreasonable at the time for them to be able to investigate and return calls and do what they needed to do in a timely fashion. In fiscal year 20, as you all will note by some of the charts, we decided from a leadership standpoint that we needed to make sure that we made our employees our priority. Although we know that our mandate is to make sure that when the public reaches out to us, that we can respond in a timely manner, but we need to make our employees a priority in order for us to be able to live out that mandate. So we decided to try to reduce the caseloads. We needed to stop assigning cases, which is why now when you see the backlog that our executive director, Alvin Gillard, spoke to, we've done everything in our power to mitigate our circumstances, but we simply are short on manpower. The key solution to where we are right now is really getting us more people. If you again, taking a look at over the last 5 or 6 years, our staffing level has remained the same. We've been able to reduce the caseloads, but in doing so, as you'll notice in fiscal year 20 and fiscal year 21, our time and process is escalating drastically. In order for us to be able to continue to respond to the public in a timely fashion, we definitely do need more manpower. Again, we know that our job at the Maryland Commission on Civil Rights is a very important one. Individuals are reaching out to us as their last-ditch effort to make sure that the discrimination that they allege is resolved. And we want to make sure that we can respond as quickly as possible. When you take a look at other like agencies in other states, we've always been held out as the cream of the crop. At one point in time, we were able to respond to complaints within 6 to 9 months. Our time and process now is exceeding over a year. We would like to try to reduce that time because we believe that Maryland is the best state, and we want to make sure that we can respond to our citizens in a more timely fashion. So hopefully that answered your questions around the historical perspective with processing. From a mitigating standpoint, what we've also tried to do, we have separated our units. We restructured our units to allow our staff to focus on specific areas of focus. Before, all of our investigators were investigating all of our authority. So it was employment, housing, and PA. Everyone was investigating everything. We've taken a different approach, and we restructured our unit so that we do have an employment unit, and we also have a housing and PA unit. We've also streamlined our written finding to allow our investigators to be able to write less and get the cases out in a much faster time frame. We've also, in partnership with our Education and Outreach Department, created a robust onboarding system so that when individuals come into our agency as new employees, they can get up to speed and hit the ground running in a much faster time frame. We have temporarily halted the transfer of cases from our federal partner, EEOC. Although that's only a temporary stopgap, it has allowed us to try to work down some of that backlog that, again, Director Gillard spoke to. So again, we know that because we have a partnership with EEOC, that is not a long-term fix. They will be ringing our phone shortly, asking us to take on some of those cases. We typically bring in anywhere from 200 to 400 cases just from EEOC alone that we are not currently intaking because of the shortage in manpower that we're currently faced with. So we are always looking for mitigating ways to make sure that the constituents of Maryland are not impacted and continue to be impacted by the staffing resource challenges that we're currently facing.
Okay, thank you very much. Thank you for that response. Senator Eckert.
Thank you very much. That's very helpful. Do you all have any idea historically, I guess before 2015, 2016, the number of staff, and then how did you also have the EEOC cases at that time so that you would have, and what, well, let me ask the rest of it and then we'll figure it out. And what kind of flexibility have you had to be able to, onboard people to be able to reduce the backlog or to reduce the time? And then, you can't bring people on and lay them off again, is what I'm saying. So how historically has that situation with the increased caseload been addressed before? And has EEOC been a consistent factor?
Great question, and thanks for that question. EEOC has been a partner for us since before I was with the agency. I've been a very long time. We've been considered partners with EEOC, and we haven't laid off employees. So at one point in time, our agency had over 100 employees. Over the years, we've lost employees, and now we find ourselves in the situation where we are now through budget cuts, layoffs, voluntary retirements. This is where we are. We are hopeful that we are able to add some additional staff to our workforce. So as we lost positions, our cases were kind of consistent with the staffing that we had. We all know in fiscal year 15 and fiscal year 16, the climate of our country and the climate of our state. As a result of that, we had a doubling in the number of complaints that we received. The number of complaints has not significantly decreased since then, and we do not expect that it will moving forward. So while fiscal year 15 and prior to that, our staffing levels were consistent with the workload that we have, we no longer find that to be the case. Also, we know that processes change over time, they evolve. The amount of work that our federal partners now require of us, and our federal partners are the Department of Housing and Urban Development, as well as the EEOC, in terms of uploading information and the admin work that we have to do in their databases is significantly more than what it was in prior years. So the amount of work that investigators have to do per case has significantly increased. And again, but the number of staffing has somewhat stayed consistent, but has definitely not met the level of work that we have. So that's the situation that we find ourselves in. And we are always looking to figure out, how do we improve? How do we get better? How can we streamline our processes that allow us to address the cases in a much faster time frame? To be honest, we're running out of options, right? You can only streamline but so much. And at this point, really, it's a matter of manpower and how do we feed the agency that is so important with the resources that they need to be able to respond to complaints of discrimination as we move forward.
Thank you very much. Thank you, Madam Chair. And I have one additional question.
Sure.
Two, do you have vacant positions, and have you requested they be filled and or that you need more help?
Great question. We currently have no vacant positions. We filled all the vacant positions that we had. We did submit an over target request. Unfortunately, we weren't successful in being able to get that over the target request, unfortunately. What we've always stated is that I think the difference for us is that we do have federal partners. So for instance, the Department of Housing and Urban Development, they pay us for every case that we do. So if we're able to bring in more pins and apply them to our housing unit, they pay us per case, which helps defray the cost of an additional pin. The same thing with our EEOC contract. They pay us per case. So when we talk about asking for additional resources and additional pins, we've never asked for the state to carry the financial burden of that because of our federal partnership. So we've always said that, hey, we have additional alternative methods of paying for the positions. We need the pins. We need the people.
Got it. Thank you very much. That's very helpful.
No problem. Thank you for your questions.
Thank you, Senator. Senator Rosapap has a question.
Thank you. So I'm a little confused. So you have the money, but not the pins for the staff you need. That's what you're saying?
We currently don't have the money in our current budget. We also don't have the pins. We made an over the target request to get the pins, and we would use some of our federal dollars to do so. So from that standpoint, because the money isn't in our budget currently, but with the additional pins, we'll have additional cases, which will bring in additional federal revenue to help pay for those pins.
Do you use contractuals?
We have used contractuals in the past, yes.
Why don't you, it would seem to me if you have federal reimbursements, I mean, I'm all for you getting more pins, but I'm just saying, unless until that happens, why wouldn't you just hire contractuals and pay for them with the federal reimbursements? In
part, that's what we have been doing. I was just speaking to the fact that we have asked for additional pins, but in our over the target request, and I'm sure our Assistant Director Nicolette Young can kind of speak more to that process because that's her wheelhouse. But we have been utilizing contractuals, so we actually do have contractuals in our staff currently. So we have utilized that process as well.
I see. How many contractuals do you have?
Nicolette, you want to speak on that?
Yes, thank you very much. Nicolette Young, Assistant Director. We currently actually have one contractual civil rights officer position in our agency. Back at the beginning of fiscal 2022, we had 3 contractual positions, of which 2 we were able to convert over to permanent positions. So yes, we did submit additional PIN requests in our budget request for FY 2023. Unfortunately, those requests were not approved. However, we will continue to work with DBM to see if we can bring contractual staffing on board in order for us to be able to take over additional cases and bring in more revenue for the agency.
Right. Well, that's what starts my question. I mean, if you have a source of revenue from your contracts, I mean, why can't you? I mean, I don't know the numbers. I don't know what reimbursements you get. I don't know the timing, but it would just seem to me that if you have a source of revenue, you ought to be able to scale up with contractuals until you get the pins.
And you're absolutely right, Senator. And as both Ms. Young and Mr. Horton have indicated, that's what we've done. But the challenge for us is if you're in a contractual position and you're offered a permanent position somewhere else.
Oh, I understand. I
right.
get
it. So it's just that sort of revolving door that we constantly find ourselves in. And then once we lose someone, then we lose time because we have to onboard and train.
I get it. No, yeah. Believe me, I get that. But thank you very, very much. Thank you, Madam Chair.
No, thank you, Senator. That's exactly where I was going to head and wrap up. I think what you've heard from the subcommittee is certainly deep concern about the backlog, knowing the frustration and the time that folks are waiting for resolution. It concerns the subcommittee, and certainly I understand it sounds like there's a timing issue with how the funding is handled, but I suspect that we'll be talking to Mr. Quist and talking as a subcommittee about how and how we might try to be helpful, because this is to have that large number of cases taking that length of time to resolve is deeply concerning. And Senator Rosapep, I think you are on a path that I was sort of thinking about, but I'm not sure. I thought the timing might be the issue in terms of the federal and special funds versus the state funds being needed to address what is clearly a long-term need.
Mm-hmm.
All right. I see no further questions for the subcommittee. Thank you very much. Thank the analyst and thank you to the commission. This concludes the hearing on the Maryland Commission on Civil Rights. Members, we're now going to turn to state archives and our budget analyst, Caleb Weiss. Good morning.
Thank you. I'm going to go ahead and share my screen here. Can everyone see the analysis document on the screen?
Yes.
Okay. We're going to start here with state archives. And the first thing we have here is the budget summary. The fiscal 2023 allowance increases by $271,000 or 3% roughly, for a total of $9.2 million in fiscal 2023. Here's Exhibit 1. This shows an overview of the agency's spending. You can see that the vast majority, 72% to be exact, is for personnel. The next two largest categories are rent and insurance at 11% and contractual services and fees at 9%. Exhibit 2, which is the proposed budget changes. You can see here that there's a number of changes in the personnel category, including reclassifications, which adds some money to the budget, and regular earnings decreases by $95,000 in fiscal 2023. In the non-personnel category down below, you can see that the major one here is an increase of $151,000 for data processing equipment expenses. Moving on to the measuring for results section, here in Exhibit 3, we have archived data by type. Here in the leftmost column, you have collections materials. This is the physical collections that the state archives keeps. And then you have two types of electronic collections or measures for electronic collections. You have electronic data and database records here. All of these types of data have increased since fiscal 2017, as you can see in the graph. The next one. Exhibit 4 here is the art collections. The state archives also holds and maintains the state-owned art collection. In fiscal 2021, the state archives added 5 new pieces to the art collection and placed an additional 7 items on display. The yellow bars are the total objects held by the state archives in the collection, and the blue bar is the number of items that are on public display. Before we get to Exhibit 5, DLS is asking that state archives should comment on whether consideration is being given to expansion of online access and programming, considering the decline in more traditional programming opportunities during the pandemic. And kind of what prompted that, as you can see here, starting in fiscal 2019 and continuing on through fiscal 2021 and the estimate for 2022, you can see a dramatic decline in the number of public programs as operations were scaled back due to COVID-19. And then on the next page, we have the recommended actions. DLS recommends concurring with the governor's allowance. That's all for my presentation. Thank you.
Hey, committee, are there any questions for the analyst? Okay, seeing none, thank you very much. We will now hear from Ms. Bachman, the State Archives Archivist and Commissioner. Is she here?
Yes, I am.
Oh, good morning. This is hard with Zoom. I'm looking through all the boxes. Good morning.
I'm up here. Thank you, Madam Chair, Senator Griffith, and members. Thank you very much for the opportunity to meet with you today. I am Elaine Rice Bachman. I'm the State Archivist, and also attending is Teresa Fawley, who is our Director of Administration, and Liz Coelho, who is our Director of Special Projects, who also serves as the Archives Legislative Liaison. I want to thank Caleb for his analysis. We are a small agency, but an agency with very specific mandate and some unique operations. And I really appreciate that Caleb, being new to the archives, came to meet with us personally, spent some time familiarizing himself with our building and meeting some of the staff. And I appreciate his excellent analysis. I really could not let the opportunity pass, since this is my first Senate budget hearing as being state archivist, without saying what an honor it is to represent this agency where I've spent my career, and how proud I am to represent the staff of all the archives, some of whom have been my colleagues for nearly 3 decades. And what a great responsibility and challenge it is to follow in the footsteps, carrying on the work of my predecessors and mentors, Dr. Edward Pappenfuss and Tim Baker. Refraining from reading any written testimony, since you all have that, I'll only comment that we are very pleased with the governor's allowance. It has restored some critical funding in 2 areas, most notably personnel. We have been able to fill the vacancies that in some cases have been out there since before the pandemic. Some have occurred during the pandemic due to retirements. And just in the past few months, we've welcomed 4 new staff members to the archive. So we really feel like we're being made whole again just by being able to fill those pressure points within our operations. We pivoted very quickly to all remote when it was necessary to do so. We're of course fully open again now, and I think it's a really it's been gratifying. I want to thank Lonnie Young, who is our HR analyst in the Department of Personnel, for working so closely with us. Again, being an agency that has classifications really that are unique to what we do here at the archives. We've been so pleased by the response to the recruitment, and it's just a real morale booster really to have new faces around our agency, and we're very grateful. Critical funding was also restored in our information technology department just to ensure that our operations, which are, our electronic records are the foundation of everything we do, and to be able to have that necessary funding to make sure we have the most up-to-date maintenance on all our systems, and also to ensure cybersecurity, which is something on all of our minds. We're very grateful to have that additional funding in those areas, and are actually currently working with the Department of Information Technology on a complete security assessment as well. There was a small amount of moderate funding returned to our art collection for conservation. Some of you may know that my role at the archives has always been originated with the art collection in the curatorial area. So I know even what value that moderate amount of funding is to ensure that we care for the collection and are able to make more of it accessible to the public. So I'm grateful for that. And then to comment on the public programming, which was noted in the analysis, like everyone, in-person programs were reduced during the pandemic, but we quickly were able to partner with the Enoch Pratt Library in creating a virtual format for a lecture series that has been ongoing now for over a year. So in where we could, we've pivoted to virtual. It does not replace the value of in-person programming, which we really hope to be able to ramp up again safely in the future. But ironically, the numbers we can reach through virtual programming far exceed those we could fit into our conference room for lectures. So it's a little bit of that good and bad. I mean, we're delighted to have that new format, and we'll definitely keep offering virtual programs as we continue and enhance our in-person programming. So with that, I'm happy to take any questions you might have.
Thanks so much. Are there any questions from the subcommittee? Okay, well, I don't see any, so congratulations to you. Welcome and thank you.
Thank you very much. Thank you all.
All right. Colleagues will now turn to the Maryland Department of Health Office of Healthcare Quality Analysis. We have Mr. Andrew Garrison back with the subcommittee. Good morning.
Good morning, Madam Chair, members of the subcommittee. Let me just share my screen here. In front of you should be the budget for the Office of Healthcare Quality. As you all know, what we have here is the agency within the health department that looks at the surveys of particular healthcare facilities. Nursing homes are something we're going to discuss in particular, but as well disability providers and assisted living units are also something that we discuss here. And what we're showing first off is we have about a $30 million budget in front of us, and we're showing a $4 million increase that comes out to about 16%. And what we're going to talk about throughout this analysis is that a lot of this increase does relate to personnel. So I'm going to jump to Exhibit 2 to get things started. And in that first section of this chart here is where you see all those personnel expenditures. And of that 4 million increase I just talked about, we're actually able to attribute nearly half of that, 1.8 million, to a turnover adjustment. And what turnover is on the budget side of things is it's a negative adjustment that's included in the allowance or the appropriation. And what that accounts for is certain parts of the year where perhaps a position might be vacant and the amount of time it takes to recruit that position. We want to have a negative adjustment in there because otherwise the positions and their salaries are budgeted for a full year. So anytime that they're vacant, we want to make sure that we're accounting for those dollars not being there. Last year in fiscal 22, the current working appropriation, this budget has a turnover budgeted at 9%. So saying about a 10%, 9% vacancy rate throughout the course of the year. And what's reflected in the fiscal 23 allowance is that being budgeted at 0%. And so that's why we're seeing such a big increase here, is because that negative adjustment went from the negative 1.8 million, reflecting about that 9% turnover, to $0, a $0 negative adjustment. And that's that 1.8 increase. The other things I want to highlight here, that next item, is reflecting an action that you all took back in 2020. Those are the salary enhancements passed with chapters 572 and 576 that increase some of the different salaries for MDH staff, nurses in particular, and this is what's reflected here. We're also going to see that again when we talk about the state hospitals and the healthcare facilities. And then below that again is another action that you all took back in 2018. Chapter 454 was the Maryland Nursing Home Resident Protection Act of 2018. And what that did was mandate positions in the budget to OHCQ to make sure that some of those surveys are getting done. It was a 5-year plan for adding personnel. We are now in year 4 of that in this budget. And so there are 10 new positions for that. And we'll point those out a little bit more later. Going back to the discussion of that turnover rate. As I said, the fiscal 23 allowance has that budget at 0%, essentially saying that throughout the course of the year, throughout the course of fiscal 23, we would expect all of these positions to be filled. That's not, and actually historically, OHCQ has had a relatively low vacancy rate, particularly in the health department. You see as recently as the summer of 2020, they had a vacancy rate pretty low there, kind of in the 4% range. However, there's obviously a demand for nursing positions, and this budget keep adding new positions. That vacancy rate has really shot up. And right now in January 2020, they've got an 18% vacancy rate. We're looking at about 40 to 42 vacancies currently, with again some additional pins coming in here in fiscal 23. And so what this is sort of reflective of, and what DLS is recommending, is that while we are supportive of some additional salary supports here for OHCQ, knowing that we do want to have these positions filled and we do want to have these surveys completed, that a 0% turnover is just out of step with what realistically was going to happen in this budget over fiscal 23. And so what we're recommending is increasing that turnover from 0% to 5%. What that results in is about $1 million reduction in OHCQ's budget. But I will highlight that this is still a much lower turnover adjustment than what they had in fiscal 22. And so it still is actually adding, under the DLS recommendation, $800,000 to still allow for some of that flexible personnel adjustments and any sort of recruitment, retention bonuses that they may need to fill a lot of these vacancies. Again, given that the budget, the agency currently has a vacancy rate of about 18%, 5% still allows a lot of wiggle room there. The other things that we talk about when we talk about OHCQ is how they are doing in terms of surveying these facilities and providers. The first one I want to highlight here is looking at nursing homes in particular, and that's the long-term care unit. During the COVID-19 pandemic, there's been a lot of additional survey activities that have had to be placed on this budget and these individuals. In particular, there's these focused infection control surveys. Some of those developed by CMS at the start of the pandemic. It's not exclusively COVID specific, but obviously does have an impact and relates to how the nursing homes are handling the pandemic and infection controls. And you can see in 21 and 22, or pardon me, 20 and 21, those type of activities really shot up. And with the staff kind of doing some of those other works, the share of annual surveys has gone down, and those are kind of the routine surveys. OHCQ does report being able to do a lot of these surveys virtually, or also looking at targeting the surveys to where there is reports and allegations of harm, but the sort of routine surveys that are statutorily mandated aren't being met by the long-term care unit. And that's also true when we look at the disability providers here in Exhibit 5, as well as in the assisted living providers. All of these do have a mandate of 100%, and which the agency is continually unable to meet. And this was also something that was pointed out by my colleagues over in the Office of Legislative Audits. It was a repeat audit finding that the OHCQ has been unable to do these annual and statutory required surveys. Lastly, the other thing I just do want to touch on again is we do see 10 new positions in this budget, again, from that action that you all took back in 2018. And we're showing here where they are distributed. And particularly, I want to highlight that this relates to some of those units in particular that have had difficulty in meeting those survey requirements, with that long-term care and developmental disabilities unit receiving some of the most pins throughout the course of this program. Again, this is a 5-year mandate. And so next year we would expect to see the last of those 10 pins, adding 50 pins to the budget. under that statute. Just to conclude, this is kind of how those numbers break down for that turnover adjustment. It's proportional to how the personnel is expended throughout the budget. So it is largely general funds, but a little bit of federal funds and special funds in there as well. Again, increasing that from 0% to 5%. That concludes my presentation, and I'd be happy to take any questions.
Thank you very much. Are there any questions from the committee? Okay, I don't see any. Mr. Garrison, thank you. We are joined again today, colleagues, by the Secretary of the Maryland Department of Health. Good morning, Secretary Schrader. You're welcome to present.
Good morning, Madam President Pro Tem and committee members. Thank you for having us today. And I also want to thank the analyst for his very good presentation. I'm joined today by Dr. Jinleen Chan, our Deputy Secretary for Public Health, our CFO, Emily Brandenburg, and we also have Webster Yee and Nick Napolitano, the Budget Director, if there are more detailed questions. I'm going to turn it over to Emily Brandenburg to address the DLS comment, and then we'll be available for questions. Emily?
Thank you, Secretary Schrader. Can everyone hear me? Great. For the record, I'm Emily Brandenburg. I am the CFO for the Maryland State Department, I almost said Department of Education, Department of Health. In response to DLS's recommendation to increase the budgeted turnover for existing positions to 5%, the department respectfully disagrees and supports the governor's allowance. The governor's budget, as introduced, focuses on maximizing the ability to hire qualified employees and to retain personnel. By increasing the budget turnover for existing positions to 5%, this recommendation creates an artificial budget limit on hiring personnel. As the number of trained surveyors directly relates to the amount of oversight of facilities, fewer surveyors will result in less oversight of the quality of care provided at healthcare facilities. It's important to note the additional funding also created through the reduction in turnover will help support the Office of Healthcare Quality be more flexible when needing to ensure salaries remain competitive within the current hiring environment. We have additional details and support for our position in our written response. And with that, we're happy to take any questions.
Madam President Pro Tem, we turn it back to you. We're available for questions from you and the committee.
Thank you. Thank you. Are there questions from the subcommittee members? Senator Eckert.
Oh, always from me.
Me too.
And I have to say, I'm really worried about long-term care. And maybe you can help us, Mr. Secretary and team. It's the staff are overworked because it's been hard to recruit and retain staff during difficult times. I've had increasing number of concerns, significant concerns from both folks who work in the industry and from families. And we've reported them, and we've encouraged folks to continue to report them. And even though there's been additional scrutiny through the pandemic, there are still some significant issues that I think we need to address. We've had a number of outside businesses come in and purchase our long-term care facilities. And even though I think there was a bill that Senator Bidle passed last year that would have a survey done as those new businesses or the new owners get up and running, I'm concerned we need some kind of a review on some of the past practices and patterns of some of these businesses. And I don't know how we get a handle on this, except maybe work with Healthcare Commission. But I'm concerned because the level of care is deteriorated just incredibly, that the word on the street is whatever you do, don't send your folks to any of our long-term care facilities. And I think that's significant. So I'm just bringing that to you. I've had conversations with folks over at healthcare quality, but I just think it's a bigger issue than I thought it was this time last year. So that's one question. And then I get a lot of questions, pro and con, on promulgation of the assisted living reg. So if you could address that, I just think it's important that we keep a discussion going about this. So if you could just respond to that, I'd appreciate it, or figure out what we have to do to help the agency. If they need more positions, then let's figure that one out too, because it's very important that we have high quality facilities if we are going to do population health. Thank you.
See if I can break that down into 3 or 4 pieces. One, I think we'd be glad to have follow-on discussion with you about the processes for quality review in both the nursing homes and the assisted living facilities. So we'll make that a priority and begin that dialogue with you. I would say over the last 2 years, we all have to acknowledge that the nursing homes have been under duress because of COVID. And that's been our top priority. We have been very fortunate in Maryland that we've been able to get our arms around the infection rate and working with the nursing homes. That there have been in the recent Omicron, we've seen because of the situation, new deaths and hospitalizations. However, for about a year and a half, the nursing homes were very, very stable, and we had it under control. So we have stepped up the resources in this latest surge. We're deploying National Guard there now to help with the staffing shortages, and we also, the governor has submitted a bill, the Healthcare Heroes bill, that would give more authority to the secretary to intervene on staffing issues with the health occupation boards, and we're hoping that bill will pass as soon as possible, so we can start to work directly on that. In terms of this budget, we have been accustomed, as you know, for the last 4 or 5 years, we've been putting regular every year new resources into OHCQ, and Deputy Secretary Chan and her oversight has been making sure that those resources are used. And we could see that at one point we actually moved OHCQ out to Gateway to give them a better facility. The morale went way up, and we saw a real change there, and it got to the point where their vacancy rate was down to 2 or 3%. So we're continuing to hire people. Of course, COVID has affected that, which is why we put so much more money into this year's budget, so that we can compete for the nurses and the nurse surveyors to go out. So I would concur with you that the surveillance of the nursing homes is one of our very top priorities, because they're the most vulnerable normally, and they're even more vulnerable in this COVID situation. So we'll follow up with you, and we're on the same page with where you're coming from.
Thank you. Did that capture them all, Senator Eckert?
More or less, we need to continue to have the discussion, but I deeply appreciate the industry's commitment. I know it's hard. I mean, if there's any kind of, you talk about nursing, I think front lines and working in our long-term care facilities, because the way our hospital care is it's set up right now, you have a lot of sicker people in our long-term care. And that's what worries me, that we have got to get back to our better standards. And I know it's been difficult through the pandemic, but I'm certainly committed to that and look forward to working with you on these issues. So thank you.
Thank you, Senator. Senator Rosapep has a question.
Thank you, Madam Chair. This is a little off topic, but not very much off topic. And if we want to move on, I appreciate that. The Secretary mentioned the role of the National Guard in helping us out during the COVID crisis. And I saw National Guard folks at Laurel Hospital last weekend who are working on the testing sites. It relates to the overall manpower issue. I have the impression that we have one of the smaller National Guards in the country. And other states, my impression is, I haven't nailed it down, have been able to put more National Guards folks to work during the crisis than we have, because we have a smaller National Guard. Data point number one, if true. Number two, I think the use of the National Guard has been terrific because we needed them, but it raises the more general question of having more surge capacity for crises. In healthcare specifically. And I just wondered, Mr. Secretary, what have you learned through that process that might be helpful strategically going forward for all these potential problems that the health department faces?
Great question, Senator. Let me see if I can keep my answer concise, because there's a long answer. I'm going to try and give you the short answer.
Thank you.
But you are right. Other states have, it's called, the term of art is force structure. And many states have much larger force structure that gives them access to more health care resources than we do. And that varies state to state. But we are using our Guard, strategically to help with mostly non-clinical missions. Right. Because what we don't want to do is take people who are working in the healthcare system, put them on active duty, and then redeploy them into the health.
Sure, I get it.
So that's part of it. But anyway, your premise is correct on the front end. As far as the surge, what we are doing, and we have an Office of Preparedness and Response at matter of fact, when I was Homeland Security Director 20 years ago, I was very actively involved with the health department then. And there is an organization called the Assistant Secretary for Preparedness and Response at the federal HHS, and they give us grant money. One of the things we've been doing is reorganizing that function within the department. I'm not waiting till after the pandemic is over. We're doing this as we speak to get more responsive. And the theory originally with OP&R was to have a small group of people who would handle all emergencies. What we are doing now is changing that paradigm. I want the Office of Preparedness and Response to train the department so the department scales faster. That's the strategy I'm using. That's a work in progress, but that's the big lesson learned, because you're exactly right. And we give money every year to the Maryland Hospital Association for our hospital preparedness program. And I've talked to Bob Atlas. We need to improve how that program works also to be better prepared to serve. So you're correct on both of your points. And we are focused on that and taking action. We're not waiting till this is over at some theoretical point in the future.
Gotcha. Thank you. Thank you, Madam Chair. I'd like to pursue this conversation more generally as we go through the process and see ways we can be helpful.
Absolutely. We'd welcome your help.
Thank you, Senator. And kind of unrelated follow-up to that, but I know that local health departments sometimes have what is like a medical reserve corps.
Yes.
Do we have anything like that at the state level as well?
We do, and that's another area. It's in that, as I was talking about how we're reorganizing, we've actually repositioned our Medical Reserve Corps under our Department of Human Resources. that originally had been for a long time an OP&R, and it was disconnected. So over the last 6 months, we've reorganized, we've repositioned it, and we're reviewing who the people are. The local health departments do use that very effectively, but that's an area that I also want to improve over time.
Certainly, thank you. Senator Young has a question.
Thank you. Just more of a comment to amplify a little bit what Senator Eckert said. I've had a lot of experience in the last couple of years with family members in nursing homes. And unfortunately, I think a number of them have just become high profit things for the owners. And I see that they hire minimum wage people with minimal training, and good records aren't being kept of the care patients are getting. And as the senator said, the word is spreading, stay away from them if you can. And I think they do supply a real need, but somehow, as far as in terms of oversight, we've got to see that the homes are actually giving the care that they promise when they take patients in, because I've seen cases where shifts change and there's no records as to whether people have been given medications or not. I've gone out and seen a relative who's in the evening still in their night clothes from the night before because somebody said it was too much trouble helping them change. There are just a lot of things that aren't happening right there. And I think if we need to help develop further regulations and inspections, we really need to do it because it's an important need, and it's not being handled well in a number of the homes. I know there are some where they are being handled. So just wanted to re-emphasize what Senator Eckert said, and I've experienced the same thing and had the same comments.
Thank you, Senator, and we will include you in those discussions and appreciate the comments.
Thank you. Are there any further comments or questions from the subcommittee? Okay, seeing none, that concludes that budget briefing. Thank you, Mr. Secretary. Thank you to the analyst. Colleagues will now turn to the Secretary of State budget, and we have Madeleine Miller as the budget analyst. Good, it's still morning. Good morning.
Good morning to you. Thank you. I'm going to now share my screen. Are you able to see a PDF? Great, thank you. So the operating budget summary is shown here for the Office of the Secretary of State. It shows that the fiscal 2023 budget decreases $1.1 million, or about 23%, and the total allowance for fiscal 23 is going to be $3.8 million. I have one item to note regarding fiscal 2022. The office received about $370,000 in American Rescue Plan Act funds through a budget amendment. These funds were intended to replace reimbursable funds from the Governor's Office of Crime Prevention, Youth and Victim Services. The ARPA funding will be used to support the Address Confidentiality program in fiscal 22, which provides victims of domestic violence and human trafficking with a free confidential mail forwarding service. The program will be supported then with general funds in fiscal 23 rather than federal or reimbursable funds. Moving to the overview of agency spending in fiscal 23, on page 2, this pie chart here shows that the majority of the office's expenses are for regular and contractual personnel, making up about 85% of the budget. Cost allocations make up the next largest portion at 7%, and contractual services are in this pie chart shown at 3%, which is a decline from the 12% share in last year's analysis. Exhibit 2 on page 3 shows changes in the proposed budget from the working appropriation to the allowance. The allowance decreases by about 1.1 million, with the difference in funds largely being split among general, federal, and reimbursable funds. The largest change is shown at the bottom of the chart. It comes from the completion of funding for the electronic filing system replacement and the notarization database to enable remote notarization in fiscal 22. The completion of funding for these replacements is also responsible for the smaller portion of funds overall that the agency is using for contractual services that I mentioned with the previous exhibit. The replacement and the upgrade of the notary database is required to process notary application forms online. Funding for this purpose was previously extended to fiscal 2022 by the Board of Public Works during cost containment actions last year. Moving then to personnel data for the agency, page 4 details the changes. There's no changes for fiscal 21 through 23 for regular personnel, but further conversations with DBM and the Secretary of State's office suggest that the number of full-time equivalent positions in the working appropriation, so fiscal 2022, is overstated. However, the change in full-time equivalents from fiscal 22 to 23 and the associating funding difference would then be overstated as well. Moving to the managing for results section of the analysis, our first key observation appears on page 5. Exhibit 3 shows how participation in the address confidentiality program has grown, as well as the number of applicant assistants each year and the number of participants who are re-enrolling each year. Program participation grew about 19% from fiscal 20 to fiscal 21. The program re-enrollment decreased 39% in the same period. Both measurements tend to fluctuate based on need, and also given that program participants are only asked to re-enroll every 4 years. Eligibility for the program was recently expanded, though, to cover survivors of threatened, attempted, or actual domestic violence, sexual assault, stalking, harassment, or human trafficking, and individuals who reside in the same household as an eligible applicant or program participant. Then moving on to the Exhibit 4 on page 6, this shows the number of notary public commissions from fiscal 2017 through 21. The Charities and Legal Services Division is responsible for processing applications and regulating and renewing commissions for notaries public in the state of Maryland. The number processed grew 32% from fiscal 20 to fiscal 21. Commissions are valid for 4 years, but really a lot of this growth is probably from the fact that an executive order extended the expiration of certain state licenses and registrations to July 30th, 2021, which was 30 days following the termination of the state of emergency, as well as the upgrades to the notary database and its improved capabilities, the online capabilities. The charitable organizations registered and the number of charitable delinquencies is shown on Exhibit 5 on page 7. The governor's executive order, which extended certain state licenses and registrations, is also relevant to these trends here. Charities that were in good standing when the emergency order was activated were exempt from registering until the emergency order expired, and those who may have become delinquent in prior years never became so. The number of charities registered has continued to trend upwards since fiscal 2016, reaching over 16,000 organizations in fiscal 21. After decreasing about 50.6% between fiscal 2016 and 2019, the number of delinquent charities increased almost 54% in fiscal 20, and then decreased again in fiscal 21 by over 22%. The office reports that decreased enforcement actions taken in fiscal 21 were the result of a temporary shift in priorities caused by the pandemic and by a vacancy in the only investigator position during the beginning of fiscal 2021. The Department of Legislative Services recommends concurring with the governor's allowance, and that concludes my presentation. I can take questions now.
Thank you very much. Are there any questions for Ms. Miller from the subcommittee? Okay, seeing none, thank you very much. We'll now turn, and I see our Secretary of State has joined us. Good morning, sir.
Good morning, Madam Chair. Thank you very much. Delighted to be with you today.
Thank you. I will turn the Zoom room over to you to respond to the analyst presentation or provide any other comments you might have.
Thank you very much. First of all, I'd like to praise Ms. Miller. Did a great job. Again, she was new to our organization, and she did a great job in learning it quickly and in doing a good presentation. So we appreciate that very much. This year has been a high point for our modernization. I think it's mentioned the ELF system, which had been held together by baling wire, and something that, of course, is a very important thing for our state, for everyone, because COMAR and all the legislation and regulations have to be promulgated through that system. So we're really pleased that that's now being worked. And also our databases for both our notaries and charities, which is going to make it much, much more convenient, both for our 90,000 notaries that we have, and also for our people in being able to process that. During the pandemic, we're all challenged, obviously, but I'm happy to tell you that every part of our organization received customer satisfaction of more than 99%. To me, absolutely amazing. And our folks really, really did a fantastic job. And we got lots of praise because when people called in, they were able to get a live person on the line and asking their questions. And so that's been, again, a real highlight. And also, I would also very proud that my folks this year, for the first time, received a national award in Washington, D.C. For service to the citizen. And we went down and accepted that award. We were the only state to receive that particular recognition. So we're really pleased about that. In the ACP program, also, one of the things that occurred, you may recall the legislation that allowed shielding of deeds, land deeds, for people to be able to buy houses anonymously. And we thought that would probably be on the order of maybe half a dozen or so people a year. Well, in 18 months, we've had 41 people that have now exercised that and bought homes under that address confidentiality program. And I'm told that we have about 10 more right now in the queue. So that's really been a really helpful thing, and obviously very important in protecting people that need that kind of protection. So as I said, it's been a good time. We've started doing town halls. Also, we had this week in our notaries, we had a town hall that had 500 people in the town hall, and we have about 4 or 5 more of those scheduled as well in the very near future. So it's been a pretty active group, and we do concur in the governor's allowance, and I'd be happy to answer any questions. I have other folks with me on the line here from our divisions if there's any specific questions that need to be addressed.
Thank you very much. Are there any questions from the subcommittee? Senator Rosapel.
Thank you. Nice to see you, Ms. Secretary, and your team.
Thank you, Senator.
I think you have the most complicated budget for the smallest agency that I'm aware of. And so I sometimes have trouble following a little bit where the P is. So just a big picture question. I don't need to understand all the puts and takes, but big picture, looking at the proposed budget for the coming year compared to the budget for the last year and the year before, kind of recent times. Is what is in the budget adequate for you to do the workload that you have?
Yes, I would say the tasks that we're doing, we've been able to do it with the personnel that we have. It's certainly going to be a lot easier with and more productive in the sense because of the upgrades on the databases and such. So that's really a big help for us. And I think will be a real help again for the future as well, clearly for the future as well.
Okay, thank you. Thank you, Madam Chair.
Thank you. Senator Eckert.
Yes, thank you very much, Mr. Secretary. I just want to say thank you, and it's good to see you this morning. You certainly are very responsive whenever we have issues or questions, and I know you try to get around to, with many of our international relation or folks that we're building relationships with around the state as well. So thank you for that commitment. It's most significant.
Thank you very much, Senator Eckert.
Thank you. I don't see any further questions for the subcommittee. I just wanted to mention a couple of things. One, again, thank you and your team for the work on the notaries. I did notice two things that one, the analyst talked a bit about the confidentiality program. And I know that in our county, really across the state and across the country, there have been challenges related to domestic violence and other issues that have come up during the pandemic that have escalated. And certainly just want to acknowledge that program and the protection that it provides for some of our employees and I mean, for some of our residents in the state, and to learn if there are any issues as it pertains to that program. And then the second thing is I was really interested in your modernization and dealing with charitable organizations. It occurred to me, the process that nonprofits often go to and find themselves applying for funds and then learning they're not in good standing. It seems like many nonprofits aren't even aware that they're not in good standing until they're applying for funds and go to get that. So I wonder if you have any town halls or re-education planned for nonprofits. So those would be the two areas I'd like to hear about.
Well, on the charity side, yes, we actually have had a town hall on the charities as well, and we're expanding that out also. So we are trying to outreach a lot more to the charities so they aren't caught in that situation. Michael Schlein, and Michael, if you want to add anything to that, please do.
Yeah, sure. Like the secretary said, we had 5 town halls for our charitable solicitation registration law last year. One of them was a repeat of the charity registration town hall and about registration requirements and needs. And we're going to run that same set of town halls again this year, doing it virtually. Everybody's figured out now in the last 2 years how to meet online. So it's actually, the virtual town halls has made outreach a little easier, and we're trying to, take advantage of that newfound knowledge and technology and outreach more and more.
No, that's great. And when you do that, if you could kind of loop me, and I'm sure maybe even some of the other subcommittee members would be interested, we can certainly share that with the nonprofits in our district through our newsletters and other communications. I think that would be extremely helpful.
Yeah.
Thank you.
We'll definitely do that. And the only thing that we're restricted is by the system itself in terms of how many people can actually come online. And in fact, we were limited initially to 250 people, but nicely this last time they actually opened it up, so we got up to 500. But you're right, and we're trying to think of ways to expand that out even further so that we can get additional people have access to it. So we're definitely working on it.
Just a suggestion, one of the things that we've done in our office, and I don't know if you've already done this, but to record a session and maybe make it available via YouTube. If you haven't already done that, that's a way that we kind of capture people that aren't able to participate in our live sessions.
I think the one problem we've had in that area is we can't because of the law restrictions, we can't tape ones that are live, because you have to get consent from everybody, and that's just almost impossible.
Yeah, we do.
But
yeah.
But what we have done is put certainly the inputs that we've used, that is the PowerPoints and such, we are putting those up on our website, so those are available. But the dialogue is again important. But we also we do put up a lot of the questions and answers that come up as well. We try to get that up on the websites also. So the common questions that often arise are taken care of. On the address confidentiality program, again, Brittany Laura is here with us, but who is the deputy director of that program. And what I will tell you is you're absolutely right. The pandemic has shown a lot of problems, even more than we've ever experienced before in domestic violence, and we're very concerned about that. And we've taken a lot of actions as much as we can to make sure that we make that as available as possible. And by the way, one of the things we did do was to reach into some of the Hispanic communities because, again, language barriers and such. What we did is we got together with the consulates of Mexico and El Salvador, and we've trained their staff people so that they can outreach, because they interact with the community, of course, all the time. So in fact, we're doing ACP training for those professionals, and we're finding that's for an area that's underserved in the Latino communities. We're definitely doing that, and we're looking for additional ways to do that more. And I do expect the ACP program is going to expand out over the coming years. Quite frankly, we have the best ACP program in the United States. There's no question about that. But thank you so much, and we really appreciate the efforts and your support of that. Thank you.
Absolutely. Kudos. Senator Rosapep.
Thank you. Sorry to come back. You mentioned that there are legal restrictions on your being able to take public town meetings that you have online.
My understanding. Josie, are you on the line?
She's not.
Okay.
I think we've hesitated. I guess you got to get consent. But there are ways to do that. We have recorded a few of our town halls regarding cybersecurity, where we had only analysts. The other factor that we were hesitant at first, I guess, knowing habits of people, is we'll take questions, and a lot of charities, or even on our notaries, they're putting out very specific information about themselves that, quite honestly, sometimes I'm surprised they share with us, and that maybe shouldn't go on a recording necessarily. I guess it's their own choice to do that, but the other aspect that we've considered maybe is trying to save some folks from themselves. Although we have looked into and recently created a YouTube channel, and we did put a couple of our town halls up there regarding the cybersecurity. Point noted though about the recording.
Well, I mean, we record these, don't we?
We do, Senator, but we do announce to people, and when people
Right.
come on, they have to click and accept the fact they're being recorded. Yes.
Right. That's why I thought it worked. So,
yeah.
I mean, the whole world is going this way.
Yeah.
I take your point about people, not protecting their own information. I get
Right.
that. But I'm a little concerned about making the perfect the enemy of the good.
Right.
And
Good point.
the point that the chairwoman was making, I think, about sharing information more broadly. My general experience out of this is that most town meetings or Zoom things that are broad interest to people are seen by more people after the fact with the recording. They're seen when the people are actually there. So I'd encourage you to figure out how to make, exactly like the chairwoman said, work in a way that's respectful for people's privacy, but get the word out. But secondly, if there are any insurmountable challenges with state law, tell us, because we could maybe help fix it.
Great. We take your point, and we'll definitely get back to you on that. Thank you very much. Good suggestion.
Thank you.
For the chair and also Senator Rosapep. Thank you. We'll do it.
Thank you, Madam Chair.
Thank you. Are there any further questions for the secretary? Okay, I don't see any further comments. Thank you to the secretary, the analyst, and to your team. That concludes the hearing, the briefing on the Secretary of State's budget. Philip, that's all we have for the day, right? Okay.
Yep.
Well, colleague, that concludes our hearings for the day. Check your emails for the next time that we will be back together again, unless you already know, Philip.
Yeah, so I think for the next 4 weeks, the subcommittee is going to be on a Thursday, Friday hearing schedule.
Phew, fasten your seatbelts. All right. Well, thank you so much. Thank you, everyone, for your participation. Please be safe, stay warm, and we'll see you next week. Thank you.